My name is Dr. Steve Samuel. I was a general surgeon for 33 years and then opened up my own vein practice called Comprehensive Vein Care. And now I'm so excited to be joining CVR and becoming one of the physicians in the awesome CVR group. It's a great story. I was a general surgeon on my legs 12, 14 hours a day for 33 years. I developed horrible vein problems. I was in the doctor's lounge between surgical cases and there was a Medtronic rep, and I just happened to ask him, hey, anything new in vein care? Because as a general surgeon, all I knew how to do was the old vein stripping. And he laughed at me and said, everything is new. And we sat down and talked. He ended up sending me to a vein doctor who performed a venous procedure on my left greater saphenous vein. And I told my wife, that was so easy. I think I might like to learn more about the vein world. So Medtronic sent me to a training session in Florida, and I became completely enamored with vein care. And that's how I got my story. I actually was a vein patient who now is a vein doctor. So I really connect with my patients when I tell them I've had all your symptoms, and if you need any of my procedures, I've had all of them too. So they trust me because I'm a patient. Well, I want to give people what someone gave me, which is healthy legs that feel good again. And, it's easy for me to do. It doesn't happen overnight, but it completely changed my life and lifestyle. And I want them to know, number one, whatever they walk in the door with, I can fix it. And that makes them feel really good because what they want to know is, can you take care of this? And the answer is absolutely. And not only can I take care of it, but you don't have to go to a hospital. There's no incisions, there's no stitches, and there's no downtime. I had my procedure at 10:30 in the morning. I had a full office at noon and 6 surgeries that day. So my patients come in the morning and they have their procedures and drive from my office to work, or they work all day and have their procedure in the afternoon. And the next day they're back to work without restrictions. So I want them to know, number one, I can take care of whatever they walk in with. Number two, they don't have to go to the hospital. It is a procedure, but it doesn't involve stitches or incisions, and there's no downtime. Well, the first thing is that I am a patient. Even though I'm a physician, I have severe venous insufficiency, and I've had these procedures done to me. And it's important for me to relay to my patients that everything they come in the door with is fixable. And you don't have to go to the hospital. You don't have to be put to sleep. I can do everything in my office with no downtime. I'd like my referring providers to know that I will see their patients within 48 hours, and that every contact I have with their patients, they will get a copy of that contact automatically. And that, if there's an emergency like a possible blood clot, they don't have to go to the hospital and wait in the x-ray department. They can come to my office and have an x-ray immediately. We have an ultrasound tech on staff Monday through Friday.